Good morning, everyone. My name is Van Din. I'm a kinesiology student in the pre-health track. Today I will cover the problems with using prescription painkillers and discussing acupuncture as a better option for pain relief needs to be used. First, prescription painkillers used in the United States is increasing. The use of within the most popular pain relief drug in the country has grown dramatically from 112 million doses prescribed in 2006 to 131 million in 2011, according to the national survey done by consulting firm IMS Health. Secondly, prescription painkillers are used for the wrong reasons. According to the Center of Disease Control, more than 12 million people reported using prescription painkillers non-medically in 2010, that is, using them without a prescription or for feeling they cause. Thirdly, prescription painkillers lead to addiction. According to the Center of Substance Abuse Prevention, the most commonly abused drug other than alcohol in the United States by individual over the age of 12 is marijuana, followed by prescription painkillers, cocaine, and hallucinogens. Fourth, prescription painkillers are costly for employers and health insurance companies. Each year, drug abuse and drug addiction cost employers over $122 billion in lost productivity time and another $15 billion in health insurance costs. Fifth, misuse and abuse of painkillers result in more hospital visits over the years. The estimated number of emergency department visits linked to non-medical use of prescription pain relievers nearly doubled between 2004 and 2009. Lastly, the death rates in the United States have increased due to prescription painkiller overdose. Prescription painkiller overdoses killed nearly 15,000 people in the U.S. in 2008. This is more than 3 times the 4,000 people killed by those drugs in 1999. Okay, so pain is a physical suffering of discomfort caused by illness or injury. Today, people are likely to take a pill that can relieve pain in an instant. We can call this the quick fix pill. Earlier, I gave you the statistics of many problems with prescription painkillers. I now want to discuss to you about acupuncture as a way of pain relief that needs to be used. So what is acupuncture? It is a medical practice that entails stimulating certain points on the body, most often with a needle penetrating the skin to alleviate pain. How does it relieve pain? It regulates a flow of energy in the body called ki. It relieves pain by releasing endorphins, the body's natural pain-killing chemicals, and by affecting the part of the brain that governs serotonin, a brain transmitter involved with mood. There was a study by the Archives of Internal Medicine which analyzed 29 studies involving almost 18,000 adults from those who were treated with acupuncture. At an average baseline pain score of 60, pain ratings fell to 30 on average. They concluded that the needle remedy worked better than usual pain treatment. Additional facts: a 2008 review of randomized trials on acupuncture highlighted a few well-designed trials whose findings indicate that acupuncture reduced migraine symptoms and is an effective as headache medication. My solution is to enforce a law that physicians have to offer acupuncture as a primary care for pain relief before prescribing painkiller medication. The physician is to provide information on acupuncture to patient and provide each patient with a prescription for acupuncture. Prescription for acupuncture will be monitored by the state to see if the physician is prescribing it first or at all for pain relief. There will be a documentation from the acupuncture of the visit and will be sent to the physician in order to monitor if patient is accepting acupuncture for pain relief. The patient will have to report to an acupuncturist at least 2 times to see if it is helping with the pain before they are able to prescribe pain medication. There will be a baseline test for pain of the patient, and by the end of the session there will be a report of differential pain indication from baseline reported by the acupuncturist, which is then reported to the physician. Physician incentives: the state will provide physicians with additional income if he or she is able to increase use of acupuncture for pain relief as a primary care and decrease the amount of prescription painkillers. The money is not going to be coming off of our taxpayers' dollars, but from acupuncturists themselves through an acupuncturist association. It is more like an association fee that will result in more income due to referrals. The penalty: if the physician does not offer acupuncture before prescribing painkillers, then he/she will be penalized $100 for every patient that was prescribed painkillers first. We can find out through the patient's medical history and the database of the doctor's prescription. To recap everything, prescription painkillers is a major problem in the United States that leads to high insurance costs, drug abuse, and finally death. My solution to reduce the major issue of drug abuse to death is to enforce a law to have physicians offer acupuncture as a primary care for pain relief before prescribing these addictive painkiller medication. The solution will reduce the amount of prescription for painkillers and not give the access to these prescription painkillers so easily. By reducing the prescription drug, it will help patients that never taken painkillers before, a new way of reducing pain and not having to experience drug abuse. Thank you.